Hi. Hello there. Hi, I'm Vicki Wilson. Thank you so much for having me today. And I'm so excited to hear everyone's stories. And thank you for listening to mine. My father, when he was 64, was diagnosed with HCC, hepatocellular carcinoma, a primary liver cancer for which the prognosis is poor. He didn't have the more well-known risk factors of cirrhosis, alcohol abuse, or hepatitis, so it was a shock. We took him to a cancer center a few hours away from us, where he had surgery to see if the cancer could be removed from his liver. It couldn't. In his follow-up doctor's appointment after the surgery, my mother, my father, and I stood in an exam room together with his surgeon. "How long do I have?" my dad asked. "A year, maybe two," the surgeon said. The surgeon left the room then to get some paperwork. I could hear him talking to colleagues in the hallway, nurses, I think. Someone must have said something funny because maybe 5 or 6 feet from the door to our room, which the doctor had left open, he and someone else were laughing loudly. Something was very funny. My father had just been told that he had probably less than 2 years left on this earth with his wife, his children, and his grandchild. And while we processed that, we listened to his doctor laughing in the hallway. When he came back into our room, he was still smiling. It felt dismissive, callous, as if the news he had just delivered was inconsequential, as if my father was insignificant. We didn't go back to that doctor. For my dad's follow-up care, we went to a new facility. When my father took off his shirt in the exam room and his new doctor saw the large abdominal scar left from his operation, the doctor was still. He looked my father in the eyes and said, "I'm so sorry this happened to you." My dad nodded. "Yes," he said, "thank you." After a few more minutes of silence, the doctor left the room. He came back with colleagues and we introduced to my father, and they spoke of possible procedures. This new facility and new doctors wouldn't cure my dad. The aggressiveness of his cancer meant that no one could. We were just trying to steal a little more time. He died the next year. But during that year, we trusted his doctors. They didn't promise to save him or give us false hope. They just chatted about his family. They laughed with him when something was funny, and they were visibly upset when the treatments we tried weren't working. 5 years later, in 2021, I was diagnosed with breast cancer. My husband and I went to 2 cancer centers for opinions on my treatment. At the first facility, I waited in multiple waiting rooms for additional imaging that seemed to duplicate what I'd already sent to them. No one explained why I needed it. When I finally got to the surgeon's office, hours after my original appointment time, the nurse taking my vitals scolded me that my heart rate was too high. "I'm anxious," I explained. "I've just been diagnosed with breast cancer." A nervous intern came in to examine me first, and then the surgeon came in himself to give me the same exam. "This is what we'll do," he said, outlining his recommendation. "Thank you," I said. "I have an appointment with another surgeon, so I'll get back to you." At the second cancer center, I met with both the oncologist I'd be working with and the surgeon in one day, with both appointments running on time. Both asked me about my family. They included my husband in the discussions. The surgeon, at the end of our meeting, sitting directly across from me and meeting my eyes, said meaningfully, "This is a very treatable, curable cancer." No one else had said that to me plainly yet, but because she had really looked at me, she knew I needed to hear it. I trusted her. The first surgeon had a plan to treat my cancer. The second had a plan to treat the woman she saw in front of her. Healthcare professionals have been through hell, especially these past few years. Insurance requirements and facility pressure and staffing shortages mean that they barely have time to treat patients. They are forced to be accurate, but fast. And then there's the personal, emotional cost to caring. Their jobs are too much. But still, somehow, some do it well. They know that when they leave the room of a patient who's just been told he's dying, they shouldn't laugh loudly only a few steps from that heartbreak and that open door. They know that a scared, newly diagnosed cancer patient shouldn't be left alone, waiting, shivering in a thin gown, getting yet another mammogram while no one will stop to explain to her why she even needs it. My father could have stayed with his first doctor and had a comparable medical outcome. I could have chosen the first cancer center I visited and maybe ended up with the same outcome. They all had similar training, facilities, and experience. But how can you trust a doctor or a place when you've gone to them for help and afterward, they leave you feeling less human than your diagnosis did? You can't. You don't. My father and I got to choose the places we trusted to be treated. Not everyone has that privilege. And looking back, the gift of having had that trust in our doctors extends well beyond the kind personal care that they delivered. That trust is the only thing that saves me now when I wonder about my father and me and if there was anything more I could have done. Thank you. Thank you so much.
Thank you, Vicki.
Thank you.
I love your writing. I think it's so powerful. And one of the chat, I think, agrees. One of the comments that's coming forward, the first surgeon had a plan to treat the cancer. The second had a plan to treat the patient sitting in front of her. I think that was so beautifully said.
Thank you. Thanks.
And so much of what we just heard, Vicki, is unforgettable. And you know, the sentence, how long do I have? You gave that to us so that we will never forget. And the laughter through the open door and the dismissiveness, you've given us through the sensuous power of the writing, things that we can now see in our own imagination and maybe metabolize in our own care of patients or our own journeys through these illnesses. Thank you, Vicki.
Oh, thank you so much.